Breast cancer is the leading cancer death among women in India and worldwide. Breast cancer is the number one cancer among Indian women, with over 1.5 lakh new breast cancer patients recorded in India in 2018. The incidence of breast cancer is increasing in the age group of 30 to 50 years, and breast cancer behaves very aggressively in this age group. Breast cancer is the most common invasive cancer in women and the second leading cause of cancer death in women after lung cancer. In India, every 4 minutes there is a woman diagnosed with breast cancer, and every 13 minutes a woman die of breast cancer. Breast cancer is on the rise both in rural and urban India. A 2018 report of breast cancer statistics recorded 1,62,468 new registered cases and 87,090 reported deaths. Cancer survival becomes more difficult in higher stages of its growth, and more than 50% of Indian women suffer from stage 3 or 4 of breast cancer. So, what are the symptoms? Breast cancer can be present with a painless lumps in the breast, discharge from the nipples, nipples pulled in, or the redness around the nipples. There can be swelling or lumps around the armpit. There is a thickening of skin around breasts, and the orange pale appearance or a swelling of breast, or one breast becoming bigger compared to the other. Now, what are the screening procedures? Women can self-diagnose their condition and know of the presence of lumps or masses that suggest cancerous outgrowths. Clinical examination by an oncologist or the physical mammograms done yearly starting from age of 40 years is recommended for breast cancer screening. Now, 6 significant risk factors that increases the chances of breast cancer are first and the foremost being a woman increases the risk factor. 98% of the breast cancer occur in women and only 2% are seen in men. Second risk factor is advancing age. 80% of breast cancer occur after the age of 50, and as you get old, your risk of getting breast cancer keeps on increasing. Third contributing factor is having your child after the age of 30 and not breastfeeding the child increases your risk. Hereditary or genetic risk above 5 to 10% of the breast cancer are familiar, meaning the cancer resulted from particular gene inherited by mother's or father's side. Unhealthy lifestyle and obesity and habits like smoking or alcohol consumption increases the risk. Last but not least is the unsupervised hormone treatment taken, such as oral contraceptives consumption more than 5 years or hormone treatment taken for menopausal symptoms without consulting doctors can add to your future risk of developing breast cancer. So if you have any of these risk factors, please visit your breast expert today and get yourself examined. Breast cancer is potentially curable if detected early due to advancement in the surgical technique, chemotherapy, hormonal and targeted therapy. Breast cancer patterns are achieving long survival and very good quality of life. Breast cancer is very frequent among females and can be fatal if not treated. Cultural issues may be a factor in why women do not access health services. Some are reluctant to consult male doctors. Many women are also dependent on other family members to get the required medical help because breast cancer is still a culturally taboo subject and rarely discussed. This often results in delays in seeking help. Survival rate of breast cancer in India are low because the detection takes place late. The only way to change these numbers is by increasing awareness. Breast cancer is a treatable disease and chances of survival are higher if it is treated in time. The only way to do is by being aware of how it can be detected, and early diagnosis can be done. Every woman should make self-inspection of her breast a top priority. Breast cancer discovered early in its progression gives the patient a better chance of controlling the disease with today's advancement technologies and treatments. So ladies, pay attention to yourself, get screened and lead a healthy life.